down to these hospitals, what they're doing is closing their emergency room, and some hospitals are closing because of the excessive number of people coming across. So the honest answer is, no, it will not be in the bill. The reality answer is that many people who are here, and there might be 30 million people here outside of the law, still have access to care at the emergency room. That presents a real dilemma for every one of us, because it is a fact that the health of all of us today depends on the health of one of us. Because if one of us in the community has this H1N1 or polio or some other disease that we don't want ourselves or our family or our children to get, then we're all at risk. So we have to find a way of solving the problem to make certain that people have a way to come here legally. And in my view, that ought to be dependent upon the economy. It ought to be our economy that determines who's coming in here to work, rather than this open border system we have now. So the honest answer is no, it won't be in the law, and the reality is people are still going to come to emergency rooms, and by federal law, no emergency room can say no to someone who's ill. In my view, we have to get primary care where it belongs, in the doctor's office, not in the emergency room, like we did with the Children's Health Care Bill. In the S-CHIP bill, which is a federally sponsored program, we guaranteed that the 11-point-something million children who are living in poverty have access to a doctor at the doctor's clinic. We will save tax dollars and save lives and improve the health of children. Now, if you want to talk about stimulating our economy, healthy children is a good start. Because if you have healthy children, they'll get the education that they need. And when they are educated, they're what I call cheaper dates. They're really going to be a bargain, because they'll be in school, they'll be productive, they'll start a small business, and they'll be very good taxpayers someday. So we have to educate our children and make sure they're healthy in school.